Hi, my name is Sara Garcia. I'm the Diabetes Nurse Educator at the Texas Diabetes Institute at the University Health System. Today we're going to talk about monitoring your blood sugar using your glucometer, your blood sugar meter. As a person living with diabetes, it's important to check your blood sugars on a regular basis to maintain good diabetes health at home in between your appointments. The first thing you want to do is wash your hands. If you're not somewhere where there's soap and water, then it's okay to use some alcohol or some hand sanitizer, but you want to make sure that you let the alcohol and the hand sanitizer dry completely before you get started. So you want to lay out your supplies on a nice, clear, clean surface. You have your lancet device, you have the lancet or the needle, your meter, your strips, gauze or tissue, and alcohol in case you weren't able to wash your hands with soap and water. So let's start by loading the lancet device. All are a little bit different. This one in particular has the numbers on top that you can dial 1 to 5, 5 being the highest, which would be a deeper poke, if you will. We're going to open it from the middle, so just turn the teardrop over. Then you have your spring. That's where the needle or lancet will go, all the way in. And you heard the click, or should hear a click. Then just take the top, turn it 2 or 3 times, and straight up. And there's your needle. Put the top back on, line it up, and lock it into place. Then we'll start at about a 2 or 3 and adjust it as you need to. Now we'll get our meter ready. Every meter has its own strips, so contour next and contour next meter. Please remember that the strips do have an expiration date, so check the expiration date, make sure that they're still good. When you're ready, you'll take out one strip. They're in an airtight container, so you want to close it right away. The strips are sensitive to light, to temperature, so make sure you keep them in the airtight container. Get your strip in, and all strips are a little bit different, but you'll have a part that looks like a computer chip that goes into your computer. Some may be down here, some might be at the side. Again, make sure you check your manual. Strip goes all the way in. You'll hear a beep. Get a countdown, and then it's asking for a drop of blood. You're ready to stick your finger and place that blood on the meter. Once you have the strip into the meter, you're ready to poke your finger. So warm up your hands if you need to. Get a good drop of blood. Then you're ready to poke your finger. We suggest that you poke at the side instead of the ball of the finger. So you're going to push up against the finger and push and poke your finger. Then you're going to massage down gently to get that little drop of blood. You don't need such a big drop. Take your meter. You want the blood to absorb from the tip, so you just touch it to the drop of blood and it'll absorb that quickly, give you a countdown, and then your result. Sure. 98. That is your reading. So next you want to take your logbook and record it into your logbook. If this is before a meal, the full apple means you haven't eaten. If it's after a meal, in this logbook the apple is eaten up, so this is after a meal. This is before my meal, so I'm going to place it right here on the correct date. You can mark the time, the date, and your reading here, and you're ready for the next one. So after you've logged your reading, you want to go ahead and take the strip out of your meter, straight out. If the meter's not already off, it'll turn off by itself. Then this can go into the trash. So now you want to take the lancet out of your device. You want to turn it again to open it and straight up. So you want to put your lancet into a sharps disposal. If you don't have a proper sharps disposal, you can use a Downy bottle, a bleach bottle, anything that's a hard plastic. With this particular lancet, you want to just push the gray strip, if you will, all the way up, and in goes your lancet into your container. Finally, always take your blood sugar log to your provider appointments so that you can review your numbers with your provider for any adjustments that are needed. Monitor your glucose levels daily to know how to better adjust your daily activity, what you eat, to manage your diabetes health successfully.